Thanks for tuning in to WWJB, JB Radio. I'm JW here with you this afternoon. And this morning, whatever time you're listening to us, we're here and we're live right now. So a reminder that this is a Ask the Expert segment as we cut into regular programming here. I've got a new program that you've heard all about. We've been promoting it all this week. And you've also heard the commercials on JB Radio. Of course, none other than Davis Family Hearing. And the show is called Here Today. The very first show. We're glad you tuned in with us this afternoon. A reminder, it is a live show where you can call in with your questions, comments, or concerns. And I've got Dr. Joanie Davis sitting right in front of me, ready to field those, and she's going to share her information with you as well. So a reminder, the phone numbers here at the station are 352-796-7272 anywhere across the Nature Coast, 1-888-613-2050 if you're streaming us online, wwjb.com. Listen to us live there as well and tune in to give us a call. So once again, 352-796-7272. And it's my proud opportunity to introduce you to another one of my friends, not only personally, but professionally, Dr. Joanie Davis with Here Today. Dr. Joanie, how are you?
I'm great. How are you, John? I'm very excited to be here.
Yes, your very first show. We'll get this one out of the way. And we expect our listeners to, of course, tune in and reach out because you are here for the community and you've been helping so many folks in the area for so long. So I want you to tell me a little bit about yourself, how you got started and what you're doing, and of course, what you do and where our folks can contact you.
Yeah, absolutely. I am one of those lucky people in the world who has the best job in the world.
That's awesome.
I enjoy everything I do. I never once wake up in the morning and don't want to go to work because it is so much fun to really improve my patients' relationships with their friends and families. And that's really what we do every day.
Yes.
I've been doing this for about 10 years. I graduated from West Virginia University about 10 years ago, and I worked for a private practice in Spring Hill, Zephyr Hills, and Crystal River for 5 years. And then 4 years ago, I purchased 2 of his offices and have opened another one of my own. We have an office on Cortez Boulevard next to Withlacoochee Electric. And we have one on Spring Hill Drive right across from Pizza Villa and Domino's. And then we have one on Little Road in Newport Richey.
I love the fact that you give us those landmarks to look for. I mean, because sometimes you get Spring Hill can be confusing because it loops around so many different times. But yeah, you buy Withlacoochee on 50, you buy the Domino's on Spring Hill Drive.
Absolutely.
Yeah, and then
Well, I try to avoid saying we're right next to Linden because I had somebody come in the other day and go, "You are so hard to find when somebody says Linden. Did you realize there are 7 Lindens in Spring Hill?"
Thank you. But go ahead.
We have been practicing for about 4 years, and we started out working primarily with diagnostics and treating hearing loss through hearing aids, and now we have completely taken off to be a full-service medical audiology clinic. There are several things that we offer that we are the only providers in 3 counties. The primary one of those is the Lyric extended wear hearing aid.
Yes, I've heard of those.
It's super cool. I always say we're not in your mother's hearing aids anymore. That's for sure. These hearing aids are completely invisible. You put them into the ear canal. We insert them into the ear canal, and the wearer wears them for 2 to 3 months at a time. They don't take them out. They don't clean them. They don't change the batteries. They can wear them swimming, in the shower.
Yeah.
Literally, all of my patients who wear them say, I just feel like everyone else. I don't feel like I have a hearing loss. Nobody can see it. They don't think about it because it's in there all of the time. This works really well for, I find, 2 different profiles of people.
Okay.
I have tons of business professionals who wear these hearing aids. And the one that pops into my mind first off is a court reporter. She doesn't want anybody to see her hearing aids. And I have a hospital administrator, and I have several nurses who are able to wear them with their stethoscopes. But then I have a whole other segment of the population who loves them because they just don't want to have to do anything. They don't want to have to deal with their hearing aid.
Yes.
So they love it that they just come in and see me, quick 15-minute appointment, and I put the hearing aid in, and they're able to go on about their day. They come in every 2 to 3 months, and I remove the existing device and put another one in because the battery does die.
Okay.
So it's just an appointment once every 3 months.
Now, I've heard that several other locations, and we don't want to mention your competitors because we always want to go to Davis Family Hearing, but they offer free batteries. Is that true in your case as well?
Yes, absolutely. Okay. We have several free battery plans. And another thing that's unique about us is that we offer a free hearing aid trial. Nobody else, to my knowledge, in Citrus, Hernando, or Pasco County offer a free hearing aid trial. Our patients come in. The initial appointment is free. We do a full hearing evaluation with one of our doctors. A hearing aid consultation. And then if they decide they want to try a device, it's completely free for 30 days. We bring them back once a week to make sure the prescription is correct, talk to them about how it's working in their lives because we want them to use it in their natural environment, make any adjustments that we need to make. And then at the end of 30 days, if they want to purchase it, they can. If they've decided that maybe they're just not ready for hearing aids or for whatever reason they want to return it, absolutely they can. There's zero obligation.
What a guarantee. You can't pass that up. 30-day free trial, folks, with hearing aids. And that's only through Davis Family Hearing. You can't find that in a clothing store. You can't wear something for 30 days. You can't take a car for 30 days. Even your teeth or eyes. I mean, you're not going to, have contacts for 30 days. And speaking of which, these, remember when contacts first came out, there were invisible glasses. And they were like,
Absolutely.
Nobody knew you wore glasses because you had contacts in. And that, when you bring up the lyrics, that's just perfect. It goes right in line with that. They're 100% invisible. You can wear them 24/7 and they're shower waterproof. So
that's actually really funny that you say that because the lyric slogan is the contact lens for your ear.
No,
yes,
I didn't know that. We learn something every day, and you're here to teach us. So thank you.
My pleasure.
A reminder, you are tuned to Here Today, a new show brought to you by Davis Family Hearing here on JB Radio. I'm JW. And phone lines are open with your questions, comments, or concerns. We're talking about hearing aids at the moment. And, of course, Joanie Davis, Dr. Joanie Davis, is in the studio with us, audiologist here in the local area. Give us a call at 352-796-7272 if you have a question. And I've got a question. Who else do you, you don't do it all yourself. You've got to have other doctors or staff, right?
I definitely could not do any of this without my amazing staff.
And who are they?
From the front office person to my staff of doctors, every single person makes a difference. I have 12 employees. And everybody has their heart in it, and everybody realizes that they make a difference in each and every patient's lives. That first person who picks up the phone to give them information and make them feel at ease. I always say the most difficult part about coming into our office is getting there. And then after you get there, you really do feel like a member of the family. But I have 3 doctors and 2 audiology residents. Dr. Michelle Frenton has been with me the longest. She did her residency with me when she was getting ready to graduate from grad school. And she's been with me for 4 years and has quite the following of patients her own.
Good.
She graduated from the University of South Florida and truly has a passion for just finding whatever solution works for each and every single patient. I always kind of chuckle when I have a conversation with her because she'll start talking to me about her day. We speak daily. She usually calls me at the end of the day and she'll say, yeah, I saw Jane today. I saw Bob today. And she's like, I really think this is going to make a big difference whenever he's seeing his patients. And Josephine's daughter was crying in the office because her mom's hearing so well and her life is so much easier. Yeah. And I look at her and I'm like, Michelle, I have no idea who you're talking about because I didn't see those patients.
Right.
She's the one who saw those patients, but she really does treat them like they're her friend and family member. And then I have Dr. Amanda Perkins, who graduated from my alma mater, West Virginia University. And it's not abnormal for me to try to see one of Dr. Perkins's patients. And they look at me and go, what are you doing in here? Where's Amanda? Because a lot of times they're on a first name basis because they truly care so much. Amanda has a passion for pediatrics. We see all ages from newborns all the way up to geriatrics. Our youngest patient is a day old because we actually go over to Oak Hill Hospital and screen newborns' hearing as soon as they're born.
Very cool.
It's a law that babies have their hearing screened before they leave the hospital, so we provide that service, and our pediatrics have taken off because of that, and Dr. Perkins really has a passion for seeing the little babies, although she does see all ages and has tons of adults like I see that just look at me and go, I don't want to see the owner. I want to see Dr. Perkins. Oh. And I just love it when they say that because it lets me know that they're doing a fabulous job.
Well, they actually teach that over there at USF, by the way. Right? Isn't that where she went?
Well, Dr. Perkins went to West Virginia University,
okay.
but Dr. Frenton went to the University of South Florida.
Right.
And along those lines, I actually have all sorts of universities in my office.
Yes.
Every year we take on 2 audiology residents, and they come through and do their residency before they get their doctorate degrees. Right now we have a student from Northeastern University in Boston, and we have one from Buffalo University in Buffalo.
And a lot of times, you treat your patients like family. Like you said, they're friends and, of course, eventually become family. And a lot of times it helps when your doctor or the person that is basically working with you is basically from the same part of the U.S. as you are. I mean, you can relate to each other. You know what I'm saying?
Absolutely.
You're building those relationships is what you're doing. And sometimes it helps. So you have, you have such a slew of doctors that can assist the folks that are coming in.
We really do.
Yeah.
We're fully staffed. There are 5 of us who see patients, and we also have lab technicians. So if we have somebody whose hearing aid just quits working at the most inopportune time, they can walk in and one of our lab technicians can see them immediately. So when you can't hear, it's really inconvenient and really frustrating. So we want to take care of those problems as soon as they happen. And our doctors have a full schedule every day. And I'm actually looking to hire some more doctors in the future. And I have 2 new residents coming on in May. And I think that's going to play out well for me as well. So tons of people there to see everyone. And I promise that every single one of them will have a huge smile on their face and welcome you with open arms, because it's not abnormal for people to come in and say, "You're always so happy.
Yes.
Your staff is always so happy. Do you ever not smile?" And the answer is really no, we don't ever not smile at our office, because we have so much fun and really enjoy interacting with our patients and making such a huge difference in their lives every single day.
And so many offices to choose from. Davis Family Hearing, once again, you're in tune to a new show here, Ask the Expert program, as part of the segment. Here Today is going to be brought to you every second and fourth Friday of the month, and heard again on Saturdays, our sister station, 99.9 FM. So once again, we'll be back right after this with Dr. Joanie Davis, Here Today.
Hi, this is Dr. Joanie Davis of Davis Family Hearing. Most people don't know we are the only cochlear implant provider in 3 counties. We are able to service the needs of every degree of hearing loss that exists. If you're interested in finding out if you are a cochlear implant candidate, call today at 352-666-8910 or visit us at davisfamilyhearing.com. We have 3 convenient locations, one located on Cortez Boulevard, one on Little Road, and one on Spring Hill Drive.
And you heard it straight from the doctor's mouth. That's Dr. Joanie Davis with Davis Family Hearing, here in the studios with you this afternoon, our listener. We're here to help you and pass on this information and educate our listeners, audiology and, of course, hearing aids and hearing loss. We know it can be an issue and it could get worse if you don't get it treated right away. So give us a call at 352-796-7272 if you have a question for Dr. Joanie Davis, here in the studio with us this afternoon till 12:30. 352-796-7272. She'd love to field your question, take your comment, or address your concern. So once again, Dr. Joanie Davis. And, we were just listening to that spot from our sponsor, which is Davis Family Hearing. You're the only provider of a implant called Cochlear implant. Tell us a little bit more about that.
Absolutely. This is hands down my favorite thing that I do every single day. Sometimes you have so much damage to your ear that a hearing aid won't help. Hearing aids amplify sound, but if they're amplifying sound to an ear that has no hearing left, it's just going to be distortion. So what we can do is bypass that distortion by implanting electrodes into the inner ear and directly stimulating the hearing nerve. And the way that process works is we work very closely with Tampa Bay Hearing Balance down at Tampa General Hospital. We work with Dr. Bartels, Dr. Danner, and Dr. Allen, and they're some of the top 5. All 3 of them are in the top 5 surgeons in the nation for cochlear implants. So I know that everybody's well cared for. They go down and have the surgery and come to us 2 weeks after the surgery, and we turn on the electricity. And that's literally what it is. We're putting electricity into the hearing nerve, and the brain interprets it as sound. So what we've done is effectively bypassed the damaged part of the ear, and we're going directly to the brain.
Okay.
This is for people who have severe to profound hearing losses those that don't get any benefit from hearing aids, and is by far the most rewarding thing that I do. Hearing loss really affects our interpersonal relationships, primarily husband and wife relationships.
Oh, sure.
I frequently say men are from Mars, women are from Venus, add a hearing loss, and good luck communicating. I have one couple that I'm thinking of right now, Nick and Marie, some of my favorite patients, have turned into personal friends of mine, but Nick has macular degeneration, so he's legally blind. He has some vision, but he's legally blind, and he's deaf in his left ear and has a significant hearing loss in his right ear. And Nick and Marie would come in and be very frustrated. They would argue with each other. Marie consistently talked about how hard her life was because of Nick's hearing loss, and Nick would also talk about how hard Marie's life was because of his hearing loss, not really mentioning his own difficulties because it was very difficult for him as well. But in general, they were very unhappy people when they first came in. Life was hard.
Sure.
And I'll never forget when we were first turning on Nick's implant, Marie actually stayed out in the waiting room. And I was kind of shocked by that because it's a huge day. He hadn't heard out of his left ear for 30 years.
Wow.
And we're putting sound into it, and he's legally blind, and I'm giving him some equipment. So I was shocked she stayed out there. But Nick's a trooper, and he did great. And that night, apparently they went out to dinner with 10 people, 5 couples.
Okay.
The guys went with the guys, the girls went with the girls, and they were sitting at a big, long table. And background noise is a very difficult situation for anybody to hear in, but much more difficult for people who have hearing loss.
I understand that.
And Marie told me that Nick looked up at her. She was at one end and he was at the other end, and he said, "I can hear what's going on."
Oh, my goodness.
And that was the first time that had happened to him in probably 15, 20 years. The next week, they came in holding hands, laughing like they were on their honeymoon.
Wow.
Marie came in and wanted to know everything about Nick's cochlear implant, and it was really a special moment. So they also told me how difficult it was for Nick to communicate with his children, and his children live in another state. So they were going away for Christmas, and they had told me stories, and I'd been with him for a little while before he was implanted, and I'd hear the frustration of how I couldn't communicate with my son, and my son got frustrated with me because I couldn't hear what he was saying. And Marie, right before they left for Christmas, looked at me and said, "Thank you for giving us a Merry Christmas."
Wow.
So it's really, truly a life-changing thing, and I get super excited every time I have a cochlear implant on my schedule, and they're exploding. We're the only cochlear implant providers in Hernando, Citrus, and Pasco County. And this is huge because prior to us servicing cochlear implants, patients had to drive all the way down to Tampa. So I have people who drive from Citrus County all the way to Tampa to see the audiologist at Tampa Bay Hearing and Balance. And we have such a great relationship with them that if they have a patient, they'll refer them up to us to do the programming. And people are starting to find out that we're there to service them. And as a result, they're doing so much better with their cochlear implants because they weren't getting the service they needed because of the drive. And when they find out we're 10 minutes down the road, it just makes them hear that much better. We call it remapping. So remapping the electrodes in the inner ear.
Right.
And I've had a ton of people that I was able to remap and get their prescription so much more spot on.
Incredible.
If your prescription isn't right in your hearing aid or your cochlear implant, it's just like if your prescription isn't right in your glasses.
Right.
You can get headaches, you can get irritated, things are blurry whenever you're listening to them. And having that prescription that's just spot on for you really just makes a huge difference and makes life so much easier.
Oh, I can imagine. Cochlear implants, you see it every day. I mean, at your office there, you're basically, it's miraculous almost. It's sort of like as close to healing somebody as you can as possibly get. But you are making a difference of people's lives here in the area. And internationally, even cochlear implants have taken a role in a lot of avenues as far as celebrities go. Who and why? I mean, you're the sole provider here. And you had mentioned why earlier, but who else? I mean, there's celebrities out there. I think Rush Limbaugh even wears them.
Rush Limbaugh's the big one. He's the primary one. He has a cochlear implant in both ears, and he is profoundly deaf. But look at him. He's in radio, and he was having difficulty hearing callers calling in. I mean, that's huge. If your job is communication and communication is difficult for you, being able to hear again is just a huge thing. And he's definitely become a spokesperson for cochlear implants. There are 3 main manufacturers. He has a cochlear implant. There's also Advanced Bionics and Medel, and that's actually something else that makes us very unique. We work with all hearing aid and cochlear implant manufacturers. So not one manufacturer has everything, and every person who walks in the door is unique, and we're able to choose exactly which product works the best for that person.
Very good, very good. And, you see a lot of your competitors out there as well who have spokespersons, but, you personally don't have like this big, thing guy or lady from the past or this big celebrity that's out there pushing Davis Family Hearing, because what you do, your service and your products, they speak for themselves. That's your spokesperson. And Dr. Joanie Davis sitting right in front of me, I've known her for years. She speaks for what she does as well. And it can be emotional sometimes, I know. You're giving somebody back their life, basically. And hearing loss is a hidden disability that can make you so socially inept. What can you tell us more about that?
Absolutely. I have so many patients who are active, and that a lot of times is a driving force. We live in a community where people want to golf and go out to dinner and socialize with their friends and go on cruises. And let's face it, part of what brings us joy in life is being able to interact with each other. Well, if you have a hearing loss, it's really easy to start developing anxiety and frustration and stress about going into that situation because you're worried you're going to say something stupid, or people aren't very accommodating of hearing loss because it is hidden. And sometimes it'll come across as you being standoffish or rude and abrasive. Your personality can actually change because of it in other people's eyes, and people are wondering what's going on. And what ends up happening a lot of times is people just stop going and doing the things that they enjoy in life. What happens when a party is stressful for you? Well, you don't really want to go. So you stay at home. I always say you stay at home. What happens when you stay at home? You sit on the couch, watch TV, eat potato chips, get heart disease, diabetes. I mean, literally, everybody laughs when I say that, but hearing loss can be untreated hearing loss can be so detrimental to a person's quality of life and overall health. But the great thing is, once we put those hearing aids on or that cochlear implant on or whatever course of treatment we pursue, we can get that hearing back. And it's not abnormal for patients to come in and say, thank you for giving me my husband back, or thank you for giving me my mother back. I can actually communicate with them, and we're not frustrated with each other anymore. One particular case I think of is I had this delightful man who had dementia and short-term memory loss, actually, and he would come in and joke, and he was just very jovial, even though he had short-term memory loss. And all of a sudden, he started to withdraw. He had an older pair of hearing aids that we were servicing, and he just kind of came in with a blank look on his face, and everybody thought that it was his dementia. And there's so many symptoms that are similar between hearing loss and dementia. And his name was Ernie. We got Ernie some new hearing aids, and the second I turned them on, he told me a joke.
Oh my goodness.
The second I turned them on. So the next week, I bring my patients back for a follow-up the week after fitting, and his wife said, thank you for giving me my husband back. She said, normally when Ernie and I go out to dinner, we rush through dinner. He doesn't really talk, and he just wants to go home after we eat.
Right.
But the day after we got our hearing aids, we went to Panera Bread and sat outside in the outdoor area. And after we ate, Ernie didn't rush out, and we enjoyed the sunshine, and we talked about our grandchildren and our children, and we talked about the birds and the weather. And she said it was the first date I've had with my husband in years.
Wow.
So thank you very much for giving me my husband back.
Wow. Incredible. So we got about 2 minutes left. And I was going to ask you about that direct link between hearing loss and memory loss or dementia, but that's a whole nother show by itself, and we'll discuss that at a later time.
Okay.
We only have 2 minutes left. So 30-day free trial at Davis Family Hearing. That's on all hearing aids.
Yes,
okay.
All models of hearing aids.
Okay. So that's only at Davis Family Hearing, and they're the only provider of cochlear implants here throughout the 3-county area. Dr. Joanie Davis in the studio with us once again on a part of the Ask the Expert segment. Heard every Friday afternoon. It's going to be second and fourth Friday. Keep it in mind and on your calendar. We're going to hear from her again in 2 weeks, and of course be replayed on our FM side, 99.9 Saturday mornings as part of the Ask the Expert segment. Once again, Dr. Joanie Davis, a program called Here Today by Davis Family Hearing. So it is a live call-in program. Keep that in mind next time if you got questions, concerns, or comments, or contact Joanie Davis herself personally, any one of her staff members or doctors at Davis Family Hearing. And that information, Joanie, is?
Our phone number is 352-666-8910. That'll work for all 3 offices. And you can also contact us on our website at www.davisfamilyhearing.com. If you'd prefer to send an email to davisfamilyhearing@gmail.com. Okay.
And your offices, your 3 offices, 2 in Hernando, 1 in Pasco. Once again, located by Withlacoochee River Electric. And that's on Cortez Boulevard, State Road 50. The one on Spring Hill Drive is by the Domino's, which is by Linden.
Yes.
Yeah. Okay. And I have been in 2 of those offices. I haven't been in the Pasco office yet, but that is located where again?
It's about a mile south of 52 on Little Road.
Okay. Wonderful. Wonderful. So that'll do it for Here Today, brought to you by Davis Family Hearing on JB Radio. We'll listen for or look for you again and hope you're listening again next time in 2 weeks when we bring back Dr. Joanie Davis here in the studio to address your hearing concerns. Thank you, Doctor.
Thank you.
Have a wonderful day. You heard it here on JB Radio.